Welcome. The topic for today's presentation is preparation of platelet-rich plasma for dermatological procedures. My name is Dr. Usma Iftikhar. So the rationale of choosing a video format was that this can be repeatedly watched, and an on-screen appearance with clear focus on learning makes it easier to exclude irrelevant information. So the learning objectives of this session are that at its end, learners shall be able to explain the mechanism of action of platelet-rich plasma or PRP, recall the prerequisites for PRP, that is the necessary equipment, the patient selection including labs, consent, etc., recall steps in the formation of PRP, enumerate indications of PRP in dermatology. So my learners are third-year postgraduates in the final year of their dermatology training. All of them possess a strong background knowledge with prior experience of procedures, that is, they are used to frequently watching videos, procedures, and appreciating it. This session was held on students' advice due to their eagerness to learn this procedure, keeping in view its aesthetic value. Participants had already undergone a pre-video session with briefing. So what is PRP? PRP is the preparation of autologous human plasma with an increased platelet concentration that is greater than the normal 150,000 to 350,000 platelets per microliter obtained by centrifuging patients' own blood. This increased platelet concentration, up to 1,000 per microliter, represents a 3 to 5-fold increase in growth factors present in platelet granules that stimulate healing and regeneration. So, what is the mechanism of action of PRP? Platelets contain growth factors and cytokines in their alpha granules, namely PDGF, that is the platelet-derived growth factor, the vascular endothelial growth factor, the fibroblast growth factor, the epithelial growth factor, and the transforming growth factor beta. So these growth factors, they are concentrated in the granules through the process of centrifugation, and then they are released via platelet activation prior to injection that augments the natural healing process. So what are the applications of PRP in dermatology? It has a wide range of applications ranging from therapeutic to aesthetic ones. The most important being in chronic wounds, including diabetic and venous ulcers, in skin rejuvenation or skin wrinkling, either alone or in combination with lasers. In alopecia areata, intralesional injections of PRP are given. In androgenic alopecia, increase in terminal hair density has been observed. It increases the survival of follicular cells when used in combination with follicular unit hair transplantation, used in scars, example in acne scars, which result from dermal atrophy in diseases like acne cysts. Um, Dermal volume augmentation, a similar mechanism to fillers in stria distensi, can be used in conjunction with laser resurfacing for effective treatment of acne scarring and rhytides as a topical treatment. So, prior to the procedure, the following criteria have to be addressed. Does the patient have any coagulopathy? Is the patient on treatment with anticoagulants, antiplatelets, NSAIDs, or is the patient pregnant? After taking the complete history and counseling the patient, the following equipment is necessary, namely alcohol swabs, tourniquet, vacutainers, syringes, and centrifuge. So the sample collection, a 20 cc of blood sample is taken in vacutainers with anticoagulants. The anticoagulant used is normally anticoagulant citrate dextrose or EDTA, that is ethinyl diamine tetraacetic acid, to prevent blood clotting. And then the blood is then centrifuged. So there are two methods of preparation of PRP, the PRP method or the Buffy coat method. We will be talking about the PRP method, which involves centrifugation at two different speeds. So after the blood is collected, about 20 cc of blood is collected in vials containing anticoagulant so as not to clot the blood immediately with the and at the collection. So, um, in the PRP method, it involves the first method involves the centrifugation at low speed, that is called the soft spin, that is 1500 rotations per minute for 6 minutes, followed by a hard spin, that is centrifugation at a higher speed, that is 2500 rotations per minute for 15 minutes. So that would yield an upper portion of platelet poor plasma, lower portion with platelet-rich plasma, and a lower globular portion rich in leukocytes and erythrocytes. So this is what the product looked like. So more elaborating on this product, like I said, you can see the upper portion of platelet poor plasma, lower portion of platelet rich plasma, and RBCs. So from 20 cc of blood, about 3 ml of pure PRP is obtained. So after obtaining the platelet-rich concentrate, the next step is platelet activation. So the platelet-rich part is extracted out of the obtained serum, and there is no consensus regarding whether the platelets should be activated prior to the procedure. If activation is carried out, it is done by adding calcium chloride or thrombin. So for calcium chloride, 10% of calcium chloride is added to the platelet-rich plasma in a ratio of 0.05 to 1 part of PRP just before injection. However, it can be used without prior activation. So some applications of PRP, in acne scarring, it is injected subcutaneously. You can see the plasma being injected intradermally into the scars. The patient is anesthetized prior to the procedure, and then the serum is injected. Um, Other indications that are the injection in the scalp for hair loss, again where it is injected after anesthesia. Another option is the use of PRP gun, as you can see in the video, which allows for easy injection into the desired areas. Thank you for watching this video. So now before we end, can all of you identify at least one condition within yourselves for which you would like to perform PRP? Thank you.